first of all, David Alport, thank you so much. A tremendous partnership that we have with GBCHealth that has gone on through many iterations and now is really coming into full flower. So thank you to you, Michael, John, everybody. I'm going to stay right here because if you're anything like we are, you have been here for a very long time today. The room is fairly dark, and it's really time for a conversation. I'm going to have the wonderful opportunity to introduce and then speak with, and with you, 3 people who are from extraordinary companies, companies that are practicing what Richard is exhorting everybody to do, using their license to lead and doing it in a way that builds responsibility and shows it, but also grows business. So, first, to my direct left is Gabi Zedlmayer from HP. Thank you. I've been practicing how to pronounce their names. Gabi is actually leading the sustainability and social innovation effort at HP. You heard something about it earlier today, and you'll hear more now. Her team is located all over the world, from China to South Africa, and from Brazil to Verblingen, all the way to Palo Alto. And together, she and her team focus on bringing innovative technology to solve some of the biggest issues that we face in health. And in fact, in our company, being pretty much evenly balanced in the industries that we work with and working extensively with the technology industry, healthcare industry, and many, many others, we recognize that HP is one of the companies that got it really early. It's not just a matter of giving away and being generous. It's a matter of living it and being it. And then to Gabi's left is Huma Abbasi, who you had the pleasure of seeing a little bit earlier today when she accepted the award on behalf of Chevron for the work that they have been doing. She is the general manager of corporate health and medical for Chevron, and she's Chevron's chief medical officer. She oversees the design and implementation of programs and services to meet health and medical needs of the company's 58,000 employees. That's a lot of employees to take care of. And they address health and medical services associated with global operations. As you heard from Richard before, it starts with your employees, and that's something that Chevron is absolutely practicing. And then to my far left is Jacob Gayle from the healthcare industry, Medtronic. And Jacob actually serves as Vice President for Community Affairs at Medtronic and Executive Director of the Medtronic Foundation. He joined the company less than a year ago, so he has some particularly strong and valuable insights into what really happens in a high-technology healthcare company that's changing the world despite having very expensive and advanced products. And what we see is that Dr. Gayle brings global health experience to Medtronic. He leads strategic development and implementation of global corporate citizenship programs, including philanthropy and employee engagement. So just to kick it off, I will say that including employee engagement and philanthropy as one person's responsibility is in itself something that I could not have said when I was sitting on the stage in the past couple of years at the GBCHealth conference. Something has changed. So I'm going to start with you, Jacob. How does your company, how does Medtronic approach the philanthropy that's action-oriented and isn't one that's just about giving away money?
Okay, sure, thanks, I appreciate it. And I'm really pleased I could be on a panel with this group today to talk a little bit about Medtronic. You know, as you said, I have a dual responsibility on the for-profit side as well as on the non-profit side with the foundation. And so it gives me a chance to see how Medtronic tries to live out its mission. It was based on a mission that, you know, to be able to alleviate pain, restore health, and to extend life. And they see that the way they can do it is by using all the resources, their for-profit side as well as their non-profit side, to make a difference. And so I think in many ways it's because employees are oftentimes attracted to Medtronic because of that mission that they see employee engagement as part of the entire product that it has to be able to make a difference in this world, to take its people, its products, and its philanthropy to try to make a difference.
So in a company where the products are so often delivered in a very high technology setting, sometimes with the patient actually unconscious.
Right.
How do you connect the Medtronic employee with the good that they're doing for the world in health? And then how does that go back to their own productivity?
Well, I think in a couple different ways you can look at it. Number one, if it's related to the business of the business, high-tech medical technology, as you said, much of which has been focused on very high premium kinds of markets. There are ways in which our employees, through skill-based volunteerism and engagement, have been involved with medical missions and programs in countries and communities where there's the medical infrastructure for supporting the high end, but for a lot of reasons, oftentimes economic, disparities in access to health care, there are populations that don't have the same access. So you can do the high end there and know that they will have continuity of care. But in the most part, in most cases, when we talk about communities in greatest need, even if we could donate those products there, they wouldn't have the infrastructure at present.
Right.
And so for that reason, Medtronic sees part of its business role is understanding what the health needs are, learning what the technologies and the interventions would be that are appropriate for those communities of lesser resource, and to build the business, innovative, disruptive business innovations that would make it a possibility.
So principles-based leadership can coexist with making some good capitalism as well. And that actually reminds me of what HP is doing, a company that clearly is making markets while you're also making health. Would love to hear more about that, Gabi.
First of all, I'd like to say that I think I've left an impression already here today. Nobody's sitting in the first row, but I left my award outside, and I'm not gonna hurt anybody here. Absolutely. Yeah, so I'm really proud to be part of HP, because I think the special thing about HP is that the founders, Bill Hewlett and Dave Packard, basically created already social value at the same time as they created business value almost 75 years ago. I mean, Dave Packard said when he created the company, let's take a step back and take a look and think about why companies exist. And he said, sure, we want to drive shareholder value and drive profitability. At the same time, we want to leave a value for society. And we want to create impact in the communities where we operate. I mean, that was forward thinking. That was 75 years ago. And I think that's part of the DNA of the company, and that's what differentiates HP from many other companies that just basically joined the wagon a few years ago. And being part of the DNA also means then that the company has understood that creating social impact is so much more powerful when at the same time you take a look at how this work really also reflects upon your reputation. Everything that we do in the social space is very important for our customers. We do all of these surveys at HP, everything gets measured. And we know that 25% of the reputation of HP is made up of the social engagement, the stuff that we do, the innovations we bring to the social space. 25%, that's a lot. And we also know that if we want to grow this company, especially in the growth markets, we got to understand these markets. We got to also showcase who we are and the portfolio that we have to offer, anything from the infrastructure, the hardware, to the services, solutions, everything, the breadth. And so we're building out reference cases. And I'd just like to give one quick example. What we did, again, together with the Clinton Health Access Initiative, starting about 2 years ago, we said, now that we decided to engage in health, where can we get started? Which issues can we get our arms around? And we realized quickly has to be with partners. And they said the first thing that we could try to tackle and attack is a pilot program in Kenya. Well, one of the issues is that when children are born and their blood gets taken, it takes up to 4 months for the blood to be returned to the mother and the health worker. Well, that's about 3 months too late for the child to be on treatment should he or she be HIV positive. So we send our employees from the Kenyan office into the market to do an assessment of the health situation in Kenya. And they said, basically what we need to do is install data centers into the country. And so 1 into the Ministry of Health, 2 in the national labs, and 2 in the remote areas. And so we transferred everything from manual to digital processes. Everything got automated. And in the end, we were able to produce these results in 20 days, back to the mother and back to the child. So we were able not only to showcase, what we can bring to the Ministry of Health, but also to other partners. We were able to engage our employees. And in the first year of operation, we've already tested 65,000 babies, and this is going to grow into other countries now, and a great way of showing how technology can make a huge difference socially, but also to the business.
It's phenomenal. It's incredible, and in fact, but it is credible. It's really happening now. And in fact, you touched on something that I want to touch on with all three of you, but first about the role of senior management in sponsoring and understanding why you need to engage in health this way. Huma, being somebody in a company, being a medical person in an energy company, tell us what your experience has been and how you have helped your company to understand that there's a lot more to health than healthcare once somebody's already sick.
Well, thank you. Thanks for the opportunity to share, having us here and share our thinking that informs our programs and processes. One thing I tell you, and you've touched on the key point, is that so why health in oil industry and why in Chevron? And I think the key is the way we look at, in Chevron, we look at health as a core value. And we at Chevron were able to recognize the link in between health and social and economic development and long-term sustainability. So when you're talking to Chevron, the oil industry was always familiar with safety. Safety was important. And then we made them realize that how integrated safety is with health. So now we've taken a very holistic approach towards health. And our programs talk not only about safety, but also health. The important, you talked about a doctor being in an oil industry. At one time, I was at a seminar, and we were talking about heart disease. And I'm sitting here with 200 engineers in the room, and I'm trying to help them understand blood pressure and arteries and veins. And I said, let me go back to the analogy in between pipes and pressure, and how pressure can increase and it can. So they understand those analogies. So you really have to change the message. You really have to talk to the management in a language they understand. And I think that has worked for Chevron. The other thing I'll touch upon is the commitment. We have adopted an approach where the commitment comes from top to bottom and bottom up. So there is tiered approach from the management towards health program. It's not within the senior manager level, it's not the middle manager, it's everyone. We have programs in different countries where the local management is committed, and it's not just corp driving the program. So I think those are some of the examples where we've really made a lot of success in defining health for the organization.
Well, one of the common threads that I'm hearing from all of you is that, as Richard might say, you're embracing the blur, that you have to really take a whole view of health in order to really make it work for your company, whether you're in the healthcare industry or in another industry. I'd love to hear something about an unexpected positive outcome that's come to your business as a result of the work that you've been doing in health. Trying to understand, of course, that there's probably nobody in this room who doesn't get it, at least somewhat, or they wouldn't be here right now. How do we bring this back to the boards, to the executive levels, to other companies and other communities, and have them understand what you get out of engaging in health beyond the obvious? So who would like to take a stab at that?
Well, a positive outcome to us was how many employees with very different skills you can get engaged. This was something that I didn't really have planned that way 2 years ago when we started our health initiatives. But then we quickly realized that what is needed is not necessarily health expertise, it's supply chain expertise. We have the biggest supply chain in IT, so we went to some of our guys to say, you need to help us, help some of these nonprofits out there, make sure the syringes get to the places where they need to be. And you don't have to be a doctor for that. So engaging employees with very, very different skills, I think that was one of the surprising outcomes. The other one to me was how quickly you can make a change. And when it seems daunting and you start getting going with the right type of partners, you can actually get your arms around some of these issues. I mean, we were lucky enough to get this fabulous award today for the work that we do with Ping and Chai and the Ministry of Health in Botswana and MASCOM there. And really, if you think about it, it was a very simple, nothing complicated approach by equipping health workers with mobile devices so that they can go out and they can upload information anywhere in the country to see, is there an outbreak of malaria? And what used to take 4 weeks to come back to the Ministry of Health, now because of a cloud solution and the analytics that Ping brought to the picture, you can do it in 3 minutes. So in 3 minutes, you know, context-based, real-time, the Ministry of Health can react to outbreaks of malaria. I mean, that is that's amazing to me. So to think about what we can do when we all come together is still amazes me every day, and I find hugely surprising and encouraging.
Well, it's extraordinary, and it's probably you know, a good moment to mention that in our Edelman Health Barometer in 2011, we found that only, and this is in just 12 countries, so the countries you're talking about probably weren't even in there, only 20% of people had used mobile technology of any sort to track, monitor, or motivate their health and use their health. But that of that 20%, the vast majority, once they tried it, stuck with it, and found that it became part of their lives. It was something like 68% for the overall adult population, and when you looked at the population between 18 to 25, it was 75%. So, and that's with the rudimentary mobile technologies that people are using right now. Most of them don't have what you're talking about. So the developed world has a lot to learn from the developing.
Yeah, and we call health the last frontier of IT, and we're always amazed how technology has transformed everything we do, the way we get information, the way we do the banking, the way we do the shopping. You travel and you go to Kigali and you put your ATM card into the machine and you get cash, and you move from South Manhattan to North Manhattan, and you probably have to photocopy your health records if you choose to go to a different doctor. At least in Germany, I still have to do that, which is totally ridiculous. So absolutely, you know, there is so much potential by using these technologies for communities, for analytics, for speed, that better access and better delivery of health is just around the corner.
It is, and I think that start with something small and make it big fast. Jacob, what's something that surprised you? And I think you mentioned to me you've been with Medtronic for 8 months.
Right.
So you must have a lot of surprises to report.
Oh, every day is a surprise. Yeah. Yeah, no, I think that one of the things I find most interesting is that people often assume a health company has always been focused on health-related philanthropy, and that's not the case with Medtronic. In the 45 years or so since it's had a foundation, it really started out firstly as a charitable giving, mainly based in the Twin Cities of Minneapolis and St. Paul, largely focused around civic organizations like museums, art galleries, symphony orchestras, et cetera. And I think in many ways it was through the movement of employees that really wanted to be more engaged in health-related philanthropy and giving that helped the company to see that, you know, really its focus, its strength is health. So why not, in fact, also serve philanthropically in health and fulfill its Medtronic mission that way? And so I think what we found very interesting is that as our employees, the vast majority of whom are giving time around the world, either on boards of organizations or serving in skilled or unskilled capacities, is that they've learned lessons by better understanding the communities in which they live and work, or even the communities where they volunteer, that have ultimately been able to bring back innovations into the philanthropy, but also into the industry that ultimately benefit people globally. So I think that we give, and in giving, we're able to learn the lessons that can be extended to others.
It is a big learning, and I, having spent the first, I don't know, 10 of my gazillion years at Edelman, focusing only on the healthcare industry, I will say that, but everyone's been wonderful. But I will say that one of the biggest challenges is helping companies that are in the healthcare industry understand that they have more health engagement social responsibility assets than anybody, but it is in their business, it is in their marketing. It's not something to find somewhere else. So the Medtronic story is an extraordinarily good example of how you identified some assets that were right there in your business.
Exactly.
It's cool, very exciting. What surprised you, Huma? Beyond, of course, I love that, teaching engineers about about hypertension by talking about pipes.
Well, at Chevron, I would say, the biggest surprise for us is the employee pull we had on the program. So for instance, if I take an example of a cardiovascular program, we started very small. We were doing a pilot in 3 countries, and today we have 11 countries who actually have the cardiovascular program. And for us, it's never been a mandatory policy. It's always been education, awareness, and then we look for that pull from the countries, and they invite us to them. The other one was, when we started talking about cardiovascular disease, we're like, gosh, if you look at the risk factors and how you can work off preventative programs, what about the other non-communicable diseases, for instance, obesity, diabetes, and cancer, and others? And then, to our surprise, our partners in countries like Angola, Nigeria, they came to us and they said, well, if you're talking, we would like to expand these programs to other diseases. We'd like to know more about obesity. We'd like to know more about diabetes, and not just for us, for our spouses, for our partners, for our communities. So that was the biggest surprise for us, and we didn't step into this knowing that there'll be so much of work. In fact, Jana's sitting here is a testimonial to that, how much work she does in 24 hours. Then the other one I would say is the external recognition. Of course, I cannot ignore that. We started in Chevron working for our employees, our workforce, and the communities we work in, and the amount of recognition and support we got, that was just tremendous. And again, a surprise for us.
So it sounds like there are at least 2 or 3 major whole view approaches to health that you're exemplifying. One being that when people are involved as employees, it makes their lives better, but it also makes them more loyal and productive within the company, right? Another is that it can be top down or bottom up. It doesn't have to be something that gets invented in the C-suite. And then a third one being that developing countries have a lot to teach to developed.
I mean, that is phenomenal. When we go out and we do a lot of work in Kenya, and it is just buzzing, and when people think they're in the right place in Silicon Valley, I can only say, just think again. And if you take a look at the buzz in Nairobi, and working with the students from Strathmore University is phenomenal. The ideas are just fantastic, and the creativity is beyond. So I think, yeah, that's where the big innovation is coming from.
Yeah, it's extraordinary. I have the fantastic honor of serving on the board of the Columbia Mailman School of Public Health, and many of you probably know the work that ICAP does there under the leadership of Wafa Al-Sadr, and that's a perfect example of something that started focusing on maternal child health and HIV/AIDS that is now becoming a beacon for teaching communities how to eat right and deal with what's known as non-communicable diseases, although I do want to go on record as saying that there is no such thing as a non-communicable disease. All diseases are communicable, and good health is also communicable.
Nancy, one of the things I want to add to that also, though, is to say that one of the values of having a employee base that's a globalized one is that it really isn't about learning from them, but it's all of us coming from different communities worldwide, being able to bring our own life experiences, the challenges as well as the lessons learned from our own communities, countries, and cultures to a global pool so that we can really share those lessons and benefit from each other.
So to some extent, what we're also seeing is that diplomacy starts with the issues that matter, as Richard was talking about, and the Trust Barometer made so clear this year, that you have to engage in the issues that are material to the world, and what's more material to the world than health. In terms of the personal side of it, just a moment on that. Look, the idea that there's your personal and professional life, I remember that expression a long time ago. I'm sorry. Does anybody know where one ends and the other one begins? What have you seen in terms of how your executives in your companies have, and just tell us the good stuff, or if you tell us the bad stuff, make believe it's about a different company. How the leaders in your company have actually not only supported good health and engaging the company in improving the health of communities in the world, but also in modeling it in their own behaviors.
I could start with the Medtronic story, and even though most of it I learned through legacy, I think the examples and the proof remain. If you look at the past, 3 or 4 CEOs of Medtronic, each of them have gone on into their personal capacities to really strengthen health care, health reform in their own communities or countries. Whether you start from the beginning with Earl Bakken, who created the pacemaker and now has created such an innovative healthcare system in Hawaii, to what Bill George and his wife have done, through others, et cetera. And I think that the whole goal has been really to be able to use their leadership and their technical knowledge, as well as the power of their voice and their influence to make a difference. Even though Omar Ishrak is just a new CEO to Medtronic, we've seen him really be able to broaden our commitment to our local community, from that being a Minnesota perception to really recognizing that we are members of a global community. And so if we are going to engage and be good citizens where we live and where we work, that means where we live and work all over the world. And I think so each of them has contributed in their own personal capacity to a broader knowledge of what we have to give and invest in social development.
That's extraordinary. I mean, I'm just wondering, just with a show of hands, how many people here are actually working for organizations or companies that are not headquartered in New York, Washington, Geneva, giant cities? And how many of you additionally might work for a company that's headquartered there, but that's not where your office is? Well, you see, that's one of the things that I've seen as an American as particularly interesting. I'm a New Yorker. We have many clients from many parts of the country, and companies like Medtronic are actually helping globalize the outlook of the American population in some ways. What are you seeing as 2 executives who were not born in this country and are now trying to make things happen here?
I can start. For Chevron, we have 60,000 employees. They're dispersed, well dispersed around the globe in different cultures, different environments. And for us, I think one of the things is that we have really valued our strategic partnerships with the local, national, and global governments, whether it's organizations or the local host governments. An example is, some of my friends from Angola, the clinicians will say that, how we've worked with the Angolan Ministry of Health and made sure that we are looking at their priorities and aligning ourselves with that. The great example is the malaria control efforts, or what we have around child vaccination. So all of these programs are tailored to at least align with the countries. The other thing from my personal experience I can tell you is that it's just been a great learning experience to learn how different things work. I came to know that coriander is cilantro in America, and eggplant is brinjal in the United States, and okra is ladyfingers in Asia. So, and this is just around one chapter of nutrition and cardiovascular programs. So you work around the country, you have to learn the language, and you have to make sure that you have fit-for-purpose programs, and you are looking at the local culture and the local business priorities.
Very key. How about you, Gabi?
Yeah, so we only started to engage in social innovation health programs about 3 years ago. We have a long history in education, done over 70 years in really investing a lot in education programs. But at the time, we said, let's really map the Millennium Development Goals against what technology can do. And we said, definitely health is an area where we can play. And every single example that I've given you in every application is just one application that can run on those type infrastructures that I described. You can run malaria, tuberculosis, HIV. It doesn't matter what the disease is. Once you have the infrastructure to differently analyze, to make decisions very quickly, to have the data available, you can port any type of disease. So we think it's so important to keep investing in this area and really to work, as you said, with the ministries of health, absolutely critical, and with the nonprofit organizations on location that just know how to tackle these issues. And I can only say how amazed I am how much you can do when you have these partnerships and bring them together. Is fabulous.
So I think this is a great opportunity for folks in the audience to actually speak to a panel where clearly it's not going perfectly at anybody's company, but where companies have really taken on health and recognized that it's a business opportunity, it's not just a business responsibility. So I have so many more questions, but I don't want to be too greedy with the time. Who would like to make a comment or ask a question of our panel?
That funding for many of the initiatives without losing the sustainability that is so crucial, because many projects thrive and then there's the issue of how do you keep it going?
I think it's a critical question, but I think also the move from going away from the funding to doing capacity building helps answer that question. I mean, we go in and we try to share the skills, no matter what it is, whether it's from the information technology side or the finance side or how you run the business side, to really build the capacity so this can work, whether we're there or not, and really going away from just handing out checks so others work on our behalf. And it might not be the perfect situation where everything is 100% up and running whilst you already move on to scale it otherwise, but I do think it really answers most of that question. It really helps, and again, with the right partners that keep really driving the programs on location, that's the best solution that I can recommend.
So it's sustainable from the start.
I can share an example from Chevron, and that makes it more real. For instance, we have a peer educator program in Nigeria where we've taken some small 10 to 12 small to medium-sized companies and trained these peer educators who are now imparting awareness and education on the subject of HIV/AIDS, malaria, tuberculosis. So that's something that's more sustainable. Instead of handing a check, we're now making sure, and I can start talking about our educational programs around STEM and others, but making sure that we have the right technical skills and knowledge in those countries so that when you are leaving the country, you're making sure that those programs will stay.
I think also that there's no one set answer. There's no one definition of sustainability either. And I think what I find across the partnerships that we have is that there are some from inception. We begin the conversation almost with how is our relationship going to end and how is it going to transition and what can we do from day one to help you as you continue to look for your next partnership, be it with government, be it with other external funders, endowment, or whatever. There's some, I think, that we recognize that sustainability in terms of economics, traditional sustainability, will never occur.
Yeah.
And so perhaps it means being able to develop a paradigm or a model that enables others to support it after we have done the part that we can do. But we do try to make it clear to everybody that this is not a permanent relationship, at least not a financially permanent relationship, but that, as was said earlier, we have many other tools in our toolkit and many other parts to what it means to be a partner with Medtronic and with Medtronic Foundation.
So the management skills, and then in addition to the distribution and marketing skills, the management skills are part of the capacity building.
Precisely.
Another, yes, comment right here.
Thank you. I'm Chris Kirubi from Kenya. These programs which these nice people are describing on support of their staff and the rest of the communities around where they operate, they look good. But as far as I'm concerned, they could be good for the big corporations who have big bucks, who can afford them. How do they advise small companies that are hardly balancing their books to imitate or to copy what they do? And secondly, I failed to ask the oil man who was there this morning. So, Huma, you are the only one who can tell me the environment, between environment and human care, which one will take over from the other for your resources? to manage, because to me, environment is a big challenge. It's as important, if not even as critical.
Yeah.
How are we going to manage these two areas, the people, welfare, and the environment, to sustain the future of this world? Thank you.
Let's take your second point first.
Yes,
because I
please.
think your first one may be embedded in that bigger second one. And I am going to ask each panelist to comment on that. And I'll start with something that I think my friends at GBCHealth know I'm going to say, which is that in our study of the health barometer last year, we realized, is health the new green? And then we said, no. Is health now green? And now we're realizing that health and green are converging. That human sustainability requires a planet to live on and healthy people. And I think each one of these companies has some good examples of how they're converging those things.
Well, I can start, you know, also because you mentioned my name now, so. Well, one thing is that, you know, I did alluded to it earlier that about the connection of the oil and gas industry to not just environment, if I may expand it to process safety. If you've heard about or seen the latest incidents that have been covered in the press around safety, you know that the whole company now wants to put resources around safety and environment. And it is a challenging place to be working and asking for resources. And if I'm being brutally honest here, you know, I can say that in oil and gas industry right now, if health, environment, and safety were the three areas, safety is the big S, and environment is the middle E, and then health is the small and a little silent H. But I can tell you that, you know, we've made a lot of stride in making that H more and more visible. When we talk about programs in our company, of course, there's always juggling of resources. You have limited resources and you want to apply it to the best possible priorities. My advice to the management and to the program executives is always like, you don't have to solve world hunger today. Take piecemeal, take those small pockets and programs where you can really make a difference and integrate that into your existing programs. And once you've done that, you will automatically come to a phase or a stage where your health becomes bigger and bigger and bigger. So that's one approach we've taken in Chevron.
And environment has been an area of focus for HP for a long, long time. If you think about it, you know, a lot of information technology, where does it end up in the end? So you have to take a look at really the recycling. So years and years and years ago, when many other companies didn't really focus on that area, we've already started to invest a lot in recycling. We've just built a recycling facility in Mombasa. We need to make sure that wherever we go and sell our product, we also find a way to then recycle the products and make sure, again, that we build the capacity on location. It's very, very important. Same thing for emissions, I mean, for the bigger environmental problems. They go hand in hand with the social issues. If you go to these markets, you can't solve one without the other. So we have to step up our efforts around health. We only started 2 years ago, so we'll have to do a lot more there and keep investing also on the environmental side. And education is the third pillar. I think all of those go together very, very closely.
And the only other one that wasn't touched on, but I think is worth, because I think it speaks very much to the issue of what about small companies and their capabilities, that not every company, but many responsible multinational companies now are actually bringing their technological understanding, whether it's agriculture, whether it's manufacturing, whether it's transportation, and they're actually working with local governments to change policy, and in doing so, actually ensure that there's education of smaller companies that they may be competing with in the same market. So it's a really tough one, but I think if we have a choice between not trying or trying and not always getting it right, we'll have to go with the latter. Another yes, hand raised really far back, and if you can, and this lady here has a mic in her hand, so she wins. Yes.
Thank you. My name is Nandi Diliza. I'm from South Africa, from the NGO community. Mine is more of a comment than a question. There's a point that was raised by Huma that the business doesn't come with a check in hand. It's more about empowering of the communities, ensure capacity building. I just want to comment that it cannot be one shoe fits all. You'll find that there is an NGO that has got the capacity in terms of the resources, the human resources who are there. People have got capacity, they've got experience, they've got the qualification, they could actually run a healthcare initiative. But the only challenge they could be having is material resources. In that case, then big business should open their minds and not say, we want to come and empower you, show you how to do a balance sheet, show you how to build a strategy. So business need to open their hearts to those situations where the NGO or the initiative is there, the community-based organization is there, it's got the people, but what they need to be assisted with is material resources. Because you might find that what is the agenda of the big organization might be slightly different from what comes from the community. And in order for an organization to ensure sustainability, it must not be a top-down approach, it needs to be a bottom-up approach so that you come to add value to people who've already got their vision, they've got their mission, they've got their strategy. And then I want to also agree that honestly, it's not only a responsibility for business to be involved in health, it is an opportunity as well because healthy communities make healthy workers, and also in order to satisfy, to ensure that business achieves the triple bottom line, it's important that one of their strategic imperatives is to be a good corporate citizen, so that they can sustain themselves, as we saw with Coca-Cola this morning. Thank you very much.
Thank you for that comment. Yeah. Thank you very much. Did you want to add something?
I think it's really important to your point there is, and where corporations can help, is what we found is that many times when we take a look at a holistic solution, we need a partner that helps with the logistics. We need a partner from the pharmaceutical area. We need a partner that can do, whatever else in order to create a solution. And we're in a better position to also pull these partners in just because we have customers, with big names and big opportunities that can come in. And so we've started to create these type of environments and ecosystems and help, basically the nonprofits where it's probably a little bit more difficult to make all of these connections. And I think the more we do there and the more we prove we can address some of these issues, because it is more than just the capacity building. I mean, there's all kinds of stuff you need, and whether it's technology or whether it's pharmaceuticals or whatever stuff we produce, we should just bring to the solving the case.
Yes. Cross-industry collaboration is something we should hear more about. Yes, do you have a mic?
Thank you. Thank you. Keith McAdam, I'm from the Royal College of Physicians in London. And the question I'd like to ask is about the priority for research in outcomes from philanthropy. And since many of the panelists here are involved with companies that spend a lot of their resources on research for development of their products, I wonder what pressure there is in developing outcomes research on philanthropic giving, and to what extent that should be part of the agenda for philanthropists to make sure that outcomes research is done, so that the things that are done can actually be implemented in an evidence-based way by the countries in which you're working.
I would just add, basically, I would say yes. I think it's very important. We have the opportunity to be able to use resources to learn and to apply that learning into contexts where there is a great need. I think we need to be able to move forward using evidence, using knowledge. One of the beauties of philanthropy is realizing that everything we do does not have to be a pure success, that sometimes there's success even in failure. But having said that, we even need to be able to study the evidence of failure to be able to better understand how we use that for good. So I think it's very important that we do the kind of research and due diligence that's involved with really understanding what the benefit is from the contributions that we make.
Yeah, and I'd actually like to pick up on that particular point after the session and talk about it, because there's the value of it to the company in the near term, and there's the value of it to the community and society in the longer.
Precisely.
And if you can't measure something for many business leaders, it doesn't count, pun intended. So very important point that needs to be made. In fact, it also segues to something else that I think Huma mentioned earlier, which is talking about the work that you're doing. I know that there are a lot of modest people in the room, people who have gone into work because they want to, they're mission-driven professionals, or because they're in a company and they're the mission-driven department inside the company. I think we've all seen that the days of keeping it to yourself are over, because the world is all communicating about everything. And myself, of course, coming from the industry that is communication, I'd love to hear from our panelists a little bit about how you're actually changing the mindset from it's unbecoming to tell people about the good things we're doing to it's our responsibility to do that and do it in an evidence-based way so that we can actually help others do the same.
It's to that point that I made earlier. I can't create this type of ecosystem with other companies unless I start talking about it. So that's very important that you fact-based go out and say, here is an opportunity, here is the issue, here's what we can do, but we need to do it together, and here is the role that you could potentially play. I also think it's really very important that you get the public recognition like we did here today. Very, very important, because then it also shows, you know, where all of that ranks in perception. So for me, one of my key priorities is also to get the word out internally. We have over 300,000 employees. I need all of them basically to start getting engaged and to start playing a role. If I don't talk to them, if I don't get them excited, if I don't show them videos as to, you know, this is what was and this is what can be, if you get involved, hard to inspire them. So if you want to get people inspired, show them the type of stuff that you do and talk about it.
Any examples of that? I could tell you more about these three companies, but you know.
This one over there.
Who over there has an example to share? A gentleman back there, I think that's a man. Can't see.
Hi, Brian Chickson from Anglo Gold Ashanti. I wasn't going to specifically share an example, but we did have a session earlier on today where we spoke about some of the things that we were doing. But you know, one of the challenges, though, that I think we face as business is we may go into the CSI or sustainability space believing that we've got all of the answers, and sometimes miss the recognition that, particularly in resource-poor settings, you know, those communities have a profound amount of tacit knowledge that can be tapped, and they have some serious stuff to contribute to the conversation. Just tying that up with the earlier comment about, well, what about small businesses? Well, when you look at it as an ecosystem, which I think is a very, very interesting way to look at it, very sustainably, is that in that ecosystem, in resource-poor settings, the small businesses have a fundamentally important role to play around bringing their sets of capabilities, because they have an on-the-ground experience that many big corporates don't have. They're engaged with the communities, they understand what's happening on the ground, and they can bring some very powerful communities to create mutual value, as opposed to us creating value for communities, but we're creating mutual value with communities.
So when you think about emerging, we always talk emerging markets. There's emerging business areas, emerging companies, emerging adults. Some of the people who have the most power of influence are people who may not have been experts for a long time, but are experts at communicating, like my colleague Emily Hackle over there, tweeter extraordinaire. We're going to finish up in a minute, and I'm going to ask each of the panelists to just use the minute, a minute for each one of you, to Share something that you hope people go away with and really think about, so when they're back at their company, they actually start something or do something differently that you really have learned. And I'll start with Gabi.
I'd say, you know, get out of your seat and start getting engaged. And sometimes it's not that difficult. It's your own community where you live and where you operate. There will be kids out there. There will be kids that you can coach and be a mentor for. There is so much that you can do in your own space. There's so much you can do as you return to your companies. It's just taking that as sort of a, this is what I'll do differently. I think at this conference we saw that if we all come together and we all play our role, we can make this a better world. And I truly believe that if everybody starts engaging, we'll find the cause and we'll basically. So absolutely.
Yes, thanks. Huma.
I would just say that if I were to give one thing, that would be developing a business case for health for your company. It's very important, it's the language your management understands. So that holistic approach, it's not just about prevention and elimination of HIV/AIDS or tuberculosis and malaria or cardiovascular heart disease, looking at your overall health of the population. You know, my vision has been optimize the human energy. And that's the message for today. You know, look at that business case, communicate it, and act on it.
If I were to say one thing, I would be one thing short. So I'm going to actually say two real quickly. One is, I think that we have to each individually and corporately find our voices. And sometimes we think that our voice doesn't make a difference. But in fact, the corporate voice as well as the individual voice can change the world. And we learned that in Medtronic, being engaged with the UN high-level meeting on non-communicable diseases, something Medtronic would not have done in the past, and realized that through the process, it was able to lend to a global community in a way that it would never have envisaged before. The second thing, I think, is that we have to remember that all of this is too much for any of us as individuals, individual company or individual person. It's really about collective action. And so when we work together around common commitments, that's actually how we change the world.
Well, so beautifully said. I have so loved the past hour chatting with the three of you, Huma Abbasi, Jacob Gayle, and Gabi Zedlmayer. Your companies, Chevron, Medtronic, HP, are exemplars not only because you're doing great work, but you know that you have more to do. So with that, I say thank you to everybody for being here and being awake. And let's all go and act on health. Thank you.
Thank you.